Suicide is one of the leading causes of death for children and adults, and there is a national campaign aimed at lowering the suicide rate by 20% by year 2020. Quote, a quote. Presently, healthcare organizations are being asked to improve the process to intervene in patients found at risk for self harm. The 2012 National Strategy for Suicide Prevention goals include developing, implementing, and monitoring effective programs that promote wellness and prevent suicide and related behaviors, provide training to community and clinical services providers on the prevention of suicide and related behaviors, and promote suicide prevention as a core component of the healthcare services. To assist in these processes, organizations are using suicide risk assessment tools. The, the goals of these tools are to identify the patients that are at risk, to implement a treatment plan, and to follow up and follow up with assessments and treatments to reduce the risk for future attempts, according to the Department of Veterans Affairs. Practitioners play a major role in ensuring that clients get the best possible care by quote unquote having a tool to guide the assessment and the risk, which made this process easier. Examples of such suicide risk assessment scales include the scale for suicide ideation, the scale for suicide intent scale, the lethality scale, Beck's hopelessness scale, the Hamilton rating scale, the Beck's depression scale, and the suicide ideation scale, and, and the suicide probability scale are all scales. Although they are used on different patient populations, each assessment tool gathers information about the patient's suicide intentions, which assesses past and present suicide ideation, and if a patient means to kill themselves, and understands the probable consequences of their action. It also evaluates the patient's intent to act and determines the level of care the patient may need. These assessment tools are used may be used to evaluate the patient's intent to act by evaluating risk factors and warning signs. Risk factors are there long before a person even begins to contemplate suicide. Other events have occurred. Risk factors can be non-modifiable and modifiable. Such pre-existing non-modifiable risk factors are age, which is usually suicide is usually higher in the young and the elderly; gender, which is usually found in males; race, which is usually found among white, which has a higher rate among white males; if there's a family history of suicide attempt; mental illness, child mistreatment, sexual trauma. Mental disorders are also a risk factors. Mood and affective disorders such as major depressions, bipolar, and postpartum, personality disorders, schizophrenia, anxiety, PTSD, substance use disorders, and eating disorders may all be a risk factor. Previous medical conditions such as a history of traumatic brain injury, terminal illness, HIV and AIDS, diagnosis of a major illness, having a chronic medical condition, and substance withdrawals. Previous attempts of self harm are the number one indicator of future self harm. Along with risk factors, assessment tools also help clinicians assess warning signs. Warning signs indicate the likelihood of suicidal behaviors occurring in the near future. For examples, according to the veterans, the VA, substance abuse disorders increase with increasing excessive substance abuse, with alcohol, drugs, and smoking. Another warning sign will be hopelessness, which is the expressed feelings that nothing can be done to improve the situation. Purposelessness, and the expressed sense of no purpose and no reason for living. Mood changes, dramatic mood changes, lack of interest, and in unusual activities and friends. Sleep disturbances such as insomnia, unable to sleep or sleeping all the time, and guilt or shame, expressing overwhelming sense of self-blame, are just some of the risk warning signs and risk factors that these self-assessment tools are looking for. According to Robinson, being able to prevent all suicides is unrealistic, but a client needs to be signposted and advised appropriately to get the best care. Research about the use of suicide assessment tools has been both positive and negative. Assessing suicide risk can be one of the most challenging aspects in a professional's roles. So the use of tools provide quote unquote framework underpins clinical decision making. Clinicians have stated that they about feel more aware of clients who had a suicide risk through the use of the suicide assessment tools. And these tools are useful, quote unquote, useful, and made asking specific questions easier to address, and the tools are effective and beneficial. The use of a suicide assessment tool alone brought, but the use of suicide assessment tool alone brought about poor predictive value and may provide false reassurance, according to Chan. Research indicates that clinicians should not rely solely on the use of suicide assessment tools, but should also engage a patient and assess the patient's risk factors and warning signs as an indicator of suicide risk.